Welcome back to Nursing with Ingrid. Thank you so much, guys. Thank you for stopping by once more. Thank you for all the love and for the support that I've gotten over the past couple of weeks. I really appreciate it. And thank you for my new subscribers, guys. I'm so humbled. Thank you very much. I really appreciate it. If you like this channel and you haven't subscribed yet, please do subscribe. If you like this video, please give it a thumbs up at the end. And if you'd like more information or you like these videos, please go to my channel and there are a few more videos that I've done. Today, I'm going to speak about something that is very interesting. And I'd just like to first say thank you very much for the questions. Thank you for the comments. And please, guys, I need you to realize that this is not just me speaking into the camera. It is a dialogue. You give me questions, you give me comments, you give me feedback. I really appreciate it. If there's questions that I can answer, I will most gladly answer them. If I cannot, I will get somebody that can. Okay? So jumping right into it. I've got a question here. It's actually two questions. So I'm going to deal with the first question in this video and stick around for the next video and we'll tackle the second question. This is from a fourth year student. Thank you very much. The question is, why are doctors paid more than nurses? A very good question. And she goes on to say that nurses perform all the duties in the ward and they provide the care both day and night. The doctor comes once a day and they get paid more. Good one. Let's jump right into it. I need us to take a step back and take a bird's eye view of a hospital. In a hospital, there are many wards, right? Let's take, for instance, there's 10 wards. There's 10 wards. There might be one ICU or two ICUs. There is outpatient departments, and there's casualty and trauma, as well as there is theater. Okay, so that is us looking from the top. At the top, we are going to see what the doctor does. The doctor comes into the ward, well and good. He does his round and he continues on and does what he needs to do, and he moves and he leaves. But what we don't realize is that doctor has got to go to another ward and do the exact same thing. And we also don't realize that the very same doctor may be on his way to theater to do some theater cases, depending on what his specialty is. We also have to bear in mind that doctors may have been on duty for the past 2 or 3 days already. They do very long calls, and in those calls, they've got all these they've got all these wards that they have to see, all these patients they have to see. Sometimes they even have to go into outpatients department where they get the next admissions, the next batch of admissions that will come to the ward. So it's not an isolated function that doctors provide. They provide a holistic function. And when that doctor also leaves, you've got to remember that he might as well be going to ICU to take a look at one of the patients that are critically ill there, okay? Sometimes the doctor will come around twice, depending on the unit that you work in, or depending on the sector that you're working in. In the private sector, the doctors will usually come in the morning and in the evening, and that will be in between those two ward rounds or between those two visits that the doctor does in the ward. He has got his theater cases, he has got his consults, he has got his consultation in another hospital. He's assisting a doctor in another hospital. Doctors work very long hours, exceptionally long hours to be exact. Now let's take that very same thought and turn it around and look at our practice. In nursing, there are different levels, right? You have your registered nurse. Your registered nurse has her own scope of practice, right? Your staff nurse also has her very own scope of practice within she works and functions. The enrolled nursing assistant also works within their own set of functions and scope which they are allowed to practice and do, okay? And I need to say this at this point. It doesn't matter which nurse you are. It doesn't matter what qualification you have. At the end of the day, we are all equally important. And not only nurses. So is the security guard that is at the gate. He's just as important because he adds value to our patients. Okay, so we cannot compare. What I'm trying to do here, or what I'm trying to say, is we cannot compare without comparing on a level, on a plateau. You cannot compare yourself to a doctor unless you're a doctor. You cannot compare yourself to a student nurse unless you're a student nurse. Likewise, I will just try and make you understand, because this is your 4th year. Next year, you will be doing ComServe, and you will realize this, that the registered nurse, the perception of the registered nurse is that they sit in the duty room and they actually do nothing. Whereas, in fact, they're making sure that the off duties are done. They're making sure that the ward is adequately stocked and staffed. They're making sure that our drugs, the controlled drugs or our scheduled drugs, they're making sure that those drugs are counted and they are correct, okay? They are making sure that at the end of the day, all the patients are receiving equal care at the same time. So their function is totally different, and it hovers above what we see as student nurses and what we see as staff nurses at the bottom, right? But when I say at the bottom, it doesn't mean that you have a lesser function. You have an equal function and an important function. And having said that, as an ENA, you are looking at the staff nurse that is rolling around with the medicine trolley or rolling around with your wound care and your dressing packs. That is work. That is the scope that that particular nurse or staff nurse functions within. Medication, we know medication is so complicated. Medication is difficult. Medication is critical. It's a critical skill. So if the nurse is assigned to doing medication for the day, she's got the patients that are getting their medication at 8 o'clock. She's got the patients that are going to get their medication at 10 o'clock. She's got the patients that are going to get their medication with their lunch. She's got the patients that are going to get their medication at 2 o'clock, and so on and so on. So having said that, what I'm saying, what I'm trying to re-emphasize to you is that everybody has their own role and function, and we cannot compare and get it twisted. And we cannot compare unless you're on that level. So doctors earn much more. And I mean, you will also be very baffled at the fact that you have grand rounds so infrequently. They happen on a rare occasion. Why? Because that is the availability of the professor, of the consultant, of the specialists, of everybody that comes and joins the grand round. So they will not be doing grand rounds every single day, because the very same doctors are very well servicing another hospital, or 2 or 3, depending on their speciality. So to answer your question, we all have different roles within the nursing or within the hospital environment, and every single one of them are important. Every single one of them are critical, but they pay differently. If you enjoyed this video, thank you very much. I would like you to press a like, and I'll see you in the next one. Take care. God bless. Bye-bye.